Welcome back to the Stay Sharp Podcast. I'm your host, Tom McGee of Stay Sharp Personal Training, and today is a very special episode. I spoke last time on the last episode about having guests joining me on the show. Guests that have been special to me, that have helped me, and that I think can help other people. And I knew once I made that decision, I had only one choice that could be my number one guest, my first round draft pick, so to speak. She's my number one pick, and I'm happy to welcome to the show Dr. Mariam Mobarak of Blue Zone Advanced Chiropractic. Thank you so much for joining me on the show, and happy to have you joining us. How are you doing?
I'm doing really good. Thank you for having me.
No, it's my pleasure. And like I said, once I made that decision, I knew there was no question you had to be the number one guest. We'll get into the why that I was so adamant that you be the number one guest. But before we get into all of that, let's go back and give us a little bit of background about yourself. How did you go from Dr. Baby Mariam to the Dr. Mariam, the chiropractor that I know and love today?
So, initially, why I got into chiropractic, is that what you're talking about here?
Yeah.
Okay. So, initially, why I got into chiropractic, I didn't even know I was going to go into chiropractic.
Okay.
It wasn't a planned thing. I didn't know what I wanted to be, as a kid and everything like
Right.
that. But I knew I wanted to do something that helped people. I wanted to do something medical, but not necessarily allopathic medical.
Okay.
Because I myself had never had great
Okay, now that's a big
experience.
word for me. Allopathic. What does that mean? I've never heard that.
So allopathic is the typical traditional MD doctor, so
Okay.
a medical doctor.
Okay.
And so, reason I didn't really want to go into that specifically is I actually wanted to avoid that
Okay.
while helping people still. And the reason is not that they aren't beneficial and not that they're helpful to so many people, but personally, in my experience, I never had success with that. I had a lot of issues growing up, hormonal, endocrine disorders, and things like that,
Okay.
as well as orthopedic issues like severe scoliosis.
Okay.
And I constantly had issues where I would wake up with rib pain, or I wouldn't be able to stand from the immense low back pain I'd be having as a 6, 7 year old.
Really? Okay.
Yeah. And so I could never really get answers. And every time I went to the orthopedist, they're like, oh, we can cut you up and put a pole in you or something
Right,
like that.
yeah.
And we never wanted that as an option. And so around 6, 7 years old, I started seeing a chiropractor, and he's what essentially kept me in decent shape so that I could
Okay.
actually function. And that's where chiropractic I knew had such a great impact. And then it was really after I saw a naturopathic doctor who was able to help me with a lot of those issues I was talking about, those endocrine issues. And she also had chiropractor in her practice as well, and they were able to do both functional medicine and chiropractic. But technically, she even told me herself that she was telling me that she would have rather gone to chiropractic school, because you can do everything that a functional medicine doctor can do as a chiropractor, because all you need to do is be able to order those tests and things like that. And that's actually what inspired me to do chiropractic.
Really?
And that was after I had already gone to undergraduate school for biology, and I wasn't sure what direction I wanted to go.
Okay. Awesome. I didn't know all that. We've never, obviously we
Yeah,
talk
we
while
never
we get
talked
to it, but we
about
never
that.
told me that. And that's really interesting. I would have
Yeah.
never guessed that you had any kind of issues like
Yeah.
that. That's wild. I can see, now I can understand what drove you into this field.
Yeah.
I don't want to say I'm thankful for that,
But I am
it
too.
worked
I mean,
out.
yeah, I
Right.
love what I do, and I love
Right.
being able to help people.
Right.
And I really love how diverse it can be.
Right.
Because chiropractic really isn't just treating only the spine. Yes,
Right.
it is our main focus, but we can
Right.
treat a whole range of things, and we can educate people. That's the
Right.
biggest thing that I love about being a more holistic doctor, is we can tell people and educate them on different ways to take care of themselves and help themselves, that don't necessarily resort to to medications, to surgery, and really things that's just as simple as lifestyle changes can
Right.
impact their life.
Right. Now you told me that this all started like when you were 6 or 7, or
Yeah, initially
Okay.
my introduction to chiropractic
Okay.
was when I was very, very young.
Okay. So did you grow up in this area? Did you grow up in Houston? Okay.
I've always been in Houston, North Houston specifically, like the Spring area, and
Okay.
now we're in the Woodlands areas where the office is.
Right.
But
And we'll get into specifically where, so people can come see you. But we'll touch base on that later. Now I do know one time you mentioned something about Dallas.
yes,
Is that where you went to school?
that is where I went to school.
Okay.
Now, my undergraduate schooling was at A&M in College
Okay.
Station, and then my postgraduate for the chiropractic degree was in Dallas at Parker University.
Okay. See, I don't know why I just assumed you were from Dallas.
Yeah. No,
Because I held that against you for a long time.
Oh,
I don't know.
really?
But no. Okay.
I would have held it against me too.
That's cool. Okay. And so how long have you been a chiropractor?
So I've been a chiropractor for a few years now.
Okay.
I graduated pretty recently, but I have several internships and I've worked with several people.
Mm-hmm.
And I've trained at a lot of seminars to
Okay.
kind of grow my skill set quite
Right.
rapidly.
Right.
And even when I was in school, I was attending these seminars
Right.
and doing everything like
Right.
that so I can be at my best so I can help people.
Okay. That's awesome, and I can attest you definitely helped me. So we'll get into how I met you. So around the end of last year, I think I first met you like it was about November, I believe it was.
Yeah.
And I have seen many different chiropractors.
Yeah.
I was in severe pain. My back, I was having issues like you were talking about. I couldn't stand up straight. I couldn't sit down for long periods of time. And unbeknownst to probably maybe one other person knows this that I told maybe 2 days ago, I had already decided that by the end of last year, if I didn't get a miracle, I was going to quit personal training.
Oh, wow.
I was going to give up on my dreams of having a gym. I was going to give up probably having to quit working out myself because I was wondering, like, because I was like on a steady down, heading down,
Yeah.
right? I felt like I was just spiraling down. And I worried that maybe my continued working out is just speeding up that process. So I was like really in a bad place physically, mentally. I was getting depressed because I've done this 30 years working out. This is my life. We talk about lifestyles.
Yeah.
This is my lifestyles. I'm thinking if I ever am able to have grandchildren, I'm not going to be able to play with them,
Yeah.
and I was just in a bad place. And I just so happened to run across a coupon.
Yeah.
And to where you were at previously, I said, well, this will get me as a better deal than the other chiropractor I'm going to. You were closer to me.
Yeah.
I said, what do I got to lose?
Exactly.
I went in, and you looked at my X-rays, and that's when I found out I had scoliosis.
Yeah.
And I was like, so then initially when you showed that to me, I was like even more depressed. I'm thinking, well, this
There's
is
more
it.
issues. You're
This
not
is
gonna
it.
get
This
better.
is it. You said, I said, when I asked you, I said, was there anything you can do for me? He said, yeah, we can take care of it. You see, you don't have any disc problems. We just need to get you, everything squared away, adjusted.
Yeah.
Okay, well, let's see what you can do. I'm, no offense, but I'm thinking this
This
smaller
is-
woman, what's she going to do? That first time you adjusted my back, I literally felt like my vertebrae click into place.
Yeah.
I mean, it was a sensation I had never had before. I mean, to feel that, where I was like somebody turned everything in the right direction. When I stood up, I felt like a completely different person.
Yeah.
I walked out of that office and I knew everything was back.
Yeah.
Like I knew I don't have to quit personal training. I can still have my dreams. I can keep working out. So, but the test was, well, how long is this going to last? I felt pretty good leaving other chiropractor offices.
But it didn't last more.
Right. By the time I got home, I was already feeling bad again, but it wasn't coming back. And the more I saw you, and the more it was just shocking to me. And like, so this is why I was so adamant that I wanted you as my premier guest, because you literally gave all that back to me. Like I thought that light at the end of the tunnel was extinguished.
Yeah.
And like you came in and turned it back on.
Well, I'm very honored to have helped you.
I mean, it was sensational. I mean, like, and that's why people probably get tired of hearing your name because everybody I meet or that I talk to, all my friends, I'm like, oh my, you got to go see this. She's wonderful. She's a miracle worker. She's just got this incredible touch. But I mean it because I know from my own personal experience what it meant to me, and for somebody to give you like your future back. That's why I'm so grateful, and that's why I was adamant. I want you on this show. I want people to see you. I want people to come visit you because I was in pain needlessly.
Yeah.
I was feeling in a bad spot, bad place mentally, needlessly. If I just would have seen you sooner, that would have been taken care of a long time ago. And all that stuff I was going through, I didn't have to go through it.
That's also what I mean when I talk about like people understanding what chiropractic does for you.
Yeah.
I mean, the reason you felt so unaligned, out of place, your nervous system wasn't functioning
Right.
properly, and your spine is what protects that nervous system.
Right.
If you have subluxations. Now, what subluxations are is a misalignment of the vertebra.
Right.
Now, that can be shifted posterior or anterior, meaning back or forward. It can be lateral shift, so it can be tilted, or it can even be rotational. Now, those small things, they put impact and pressure on the nerves.
Right.
When you have that impact and pressure on the nerves, all of your body doesn't function properly. It's not just pain. Your nervous system also controls motor control, so your ability to move your body the way you want to. It and controls also all of the organs in your body. So
Right.
feeling sluggish can also be a symptom of misalignment,
Mm-hmm.
of subluxation.
Mm-hmm.
So I mean, I'm glad that you came, that we were able to help you.
Yeah,
But
yeah.
and I'm
It
glad that
was
it's had
life changing.
yeah.
I mean, truly life changing. So you've adjusted me. You've also, I've also got that rib that gives me
Yes.
issues, and and it's funny because I would just tell you, like I got that, and you can feel it,
Yeah.
and you just put it right back into place. So you've done those for me. Now you've done other treatments for me,
Yes.
like the
Like
shockwave
yeah,
therapy. Like what
exactly.
exactly does that do?
So shockwave, it uses acoustic sound wave to penetrate deep into the tissue up to about 5 centimeters,
Mm.
depending on the setting and things like that you have it on. But what it does, it allows the cells in the tissue to try to start to heal, and it starts that healing process over again. Imagine you have a scar,
Right.
okay? That scar, or you imagine you get injured, and when it heals, there's a little scar left,
Right.
and that tissue is tight around it, and it still sometimes aches when you press it, right? That means it was never truly fully healed.
Right.
Similar things happen, for example, with a tendinitis or with rotator cuff injuries, or for example, like you tested pretty positive for rotator cuff injuries, and they're just not healing the way they should.
Now positive though is like that's not good.
Yeah, positive is not good.
Right.
So when you test positive on an orthopedic test, that means you're testing positive for having the disorder.
Right.
So when we tested that and those things came back positive, what I mean by that is you can be very positive, slightly positive, or negative, which is not having the issue at all. You were positive, slightly positive, meaning it wasn't a full tear. It may have not even been a partial tear, but it is either a sprain, strain, and this prevents us from having to need an MRI or an ultrasound to have this information.
Right.
And so that lets us know where to work. And so
Okay.
what the shockwave does is it goes in, and it's also used as a diagnostic tool. It goes in and it works on that damaged tissue, and when you get shockwave, you'll realize it only ever hurts where there is damaged tissue.
Right.
Now, if I put this over somewhere healthy, you're not going to feel anything, and that's because it doesn't target healthy cells, only damaged ones, and allows them to regenerate.
Right.
And it actually triggers your body to create stem cells to come to that area and heal that.
Yeah, because so I've had it a couple times, and initially it was really like in the front that we were noticing it.
Yeah.
But then I was kind of like curious, like this last time I got it, we weren't feeling it there. It was in the back.
Yeah.
And then you mentioned, well, that's because now that
now
means
the
it's
front
healed.
is healing.
Yeah.
And so we're targeting other places. Now
Yeah.
you use a certain amount of pulses with the shockwave, so we can't necessarily do all of the spots
Right.
at once. But the good thing is when we do it, we keep searching to see if there is anything still lingering. And so
Okay. And so I've gotten that treatment, and you've also done with the dry
the needles.
needling.
Yes.
So how exactly does that work? Because that really was kind of wild to me.
I know. It is pretty insane how fast that works too. So what dry needling is you insert a very thin needle into a contracted or spastic muscle. So for example, if you have tight traps and they're always knotted up, what those knots are trigger points. And that's what we're inserting the needles into. Trigger points are muscular imbalances. So we go and we insert that needle into that trigger point, into the belly of it, and that takes that muscle immediately from that contracted state to an elongated state. So you don't feel that tension anymore, and that whatever it's pulling on, so whatever that muscle inserts and originates from, gets relaxed as well. So a tight neck immediately relaxes. Tight, painful shoulders immediately relaxes if we work on that one little area.
Yeah. How do you know how deep to go? I mean, that's just your technique.
Well,
I mean, you just know. I mean,
to an extent, so when you're using, we've taken gross anatomy lab.
Right.
So for the most part, we've actually been able to feel all of the muscles of the body without under the tissue, without having to go through the skin. Obviously, we remove all of that in gross anatomy, and we actually get to see and feel and study the muscles and understand how they attach to the body, where the nerves run, where the vessels run, and the arteries, and how to avoid those things. And we're taught those things as well, and with biomechanics and all of that in school. But also with dry needling, you go at a certain angle, so you don't go ever directly in at a 90-degree angle.
Okay.
So you're almost always going about 45 degrees, if not completely parallel to the skin.
Okay.
So it's almost impossible to injure something as long as you know what direction to go, where the muscle lies, and what vital organs or tissues or vessels or arteries are there, and how to avoid them.
Right. Okay. So those are the types of treatments I've got.
Yes.
What other types of treatments do you do on people that
that come in?
Yeah.
So we do a lot, actually.
Right.
So those are two of the many services and things that we do as chiropractors. We also do obviously the adjustments. We do decompression therapy. Okay. Decompression therapy is actually something that is amazing and helps people prevent them from needing disc surgery or even possibly fusions, things like that for degenerated discs, for herniated disc protrusions, things like that are, for example, leading to numbness, tingling, complete loss of motor control sometimes in the upper and lower limbs. Right. And what it is a very slow, so how you do it is the table you'll be strapped into the table, okay? Then depending on what we're working on, it's going to pull the vertebral segments, so the bones in your back, apart slowly over a period of time, typically 20 to 30 minutes long. And it opens and closes that space and creates a negative pressure in the disc. So what that does is it allows the fluid that may have bulged or left the disc that pinches that nerve to reabsorb. Okay. And doing that repetitively allows the disc to actually heal and allows that space to become normal again, so you're no longer compressing and closing down on the nerve that exits on the sides of the discs. Gotcha. So it's pretty amazing what that can do. We've had a patient who went to the hospital for what she believed was a stroke. Right. And what ended up happening was they told her, you didn't have a stroke, but you are presenting completely stroke-like symptoms. Right. So we don't know what's going on. She saw neurologists. She saw endocrinologists. She saw cardiologists. She saw everyone for this issue, and no one could give her some answers. She came in. We saw all of the reports. We took some x-rays. And on her x-rays, she had no space at any level in her neck. But she wasn't fused. There was nothing preventing that space from reopening back up. And her MRIs I had her take an MRI of the neck as well. And the MRI of the neck showed herniations and bulges at every single level in the neck. We started doing just cervical decompression on her. And I believe after the 7th visit, her face stopped drooping. Really? She started to regain all of the sensation in her arm. It was no longer heavy to pick up and to move. It was pretty amazing how quick, and that's not even halfway through her protocol.
That's awesome.
So it is pretty amazing.
And I imagine she's like totally grateful and happy.
Yeah, she's ecstatic. She's like, I can live my life again.
Yeah, so. Yeah. To know it's not a stroke, not something going on with my brain and all that, and to know it's not a simple procedure, but something like that.
It's something that doesn't require surgery and something that is fixable in small terms.
Right. So is there anything else, other than that also too? What else do y'all do?
We also do functional medicine here. So what that means, because it's a pretty broad term, is we will, when the person comes in, we ask them a bunch of questions. Obviously, we consult, we see what they're experiencing. Then we have them go through a list of probably like 200, 300 symptoms and questions about systems in the body. And what that does is give us some insight, and then we take functional labs. So that could be stool tests, saliva tests, and then blood work, but we don't measure that on the typical ranges that you see whenever you go to the doctor. Right. Those ranges are actually the ranges for everybody in the geographic area. Not everybody in your age range, or in your sex, or in the lifestyle and the typical and in the demographic of what your body is, right? Okay. And so instead, we measure that against someone who's, depending on the person, someone who's healthy, male, female, whatever it may be in their age group. And then we can identify what things are functionally off, because those ranges are very broad. So you may be relatively high or relatively low and not have any idea, because on that range, it appears normal. Then we take those results and we determine what the patient is missing or maybe lacking or deficient in, or things that they are too high in. That could also, we also do food sensitivity testing, toxin testing, things like that. Okay. And we see what we either need to add or eliminate. Okay. And that helps regain a lot of their function, also helps eliminate a lot of their issues, whether it be GI, endocrine based, so female hormone, male hormone, it could be thyroid disorders, a lot of different things. Right. And we work on those things, and over a period of time we see what happens with their body, and we analyze and we adapt if we need to, and change things if we need to, and then the patient responds very well. Okay. And yeah, that's very cool.
That is very awesome. I didn't realize all that stuff was involved.
And that's what I was talking about when I said, do you remember the story about the naturopath who also had a chiropractor with her? The chiropractor was also doing the exact same stuff that she was doing. Okay. And was able to do all of that as well as treat people with physical medicine, which is what chiropractic is.
Right. That's crazy. That's amazing to me. Yeah. I just thought it was just you know.
Right.
And go.
and
Uh-huh.
I mean, there's no reason that you wouldn't, or most people wouldn't know anything otherwise. I mean, it's just what's out there.
Right.
So
Right. And you just telling me these things and the things that it can treat even makes me more like, because I know people with these issues
yeah.
that I didn't know that you could even treat those also. And so now I'm like super excited to tell them, hey, you need to to come here.
Well, yeah. There's a lot we can do without needing drugs
Right.
and
And
things
yeah,
like that.
I'm very big. Do whatever you can do before they start cutting into
Exactly.
you and doing all that stuff. And man, that's just wild. So as far as like your talents and stuff, so how do you know? How do you feel? Because I can just tell you, and this is what feels so. I can just tell you something's not right, and you can literally feel it and can tell what's wrong and fix it like instantly. Like, is that? I have to believe not everybody has that talent. Do you think it's just a talent? Is it just a skill you've learned? Is it a little bit of both?
It's a little bit of both
Right.
because the thing is, we before we're allowed to even adjust, we take so many classes on just feeling. Literally, they're called palpation classes and
Okay.
motion palpation classes. So it's on understanding how things in the spine and the joints move.
Right.
So before we do anything, we have to understand how to measure those things, how to feel those things, and we're taught a million different ways to also visually see it, not
Okay.
just physically feel it with our hands.
Right.
And so it's a lot of that, but then it's also a lot of repetition and experience and feeling different bodies and feeling different people to know those
Right.
things. But then there's also a lot of different techniques, and if you can really understand, so every technique in chiropractic, like diversified, Gonstead, Thompson, activator, which are all different adjustment types of techniques, also have um, their own analysis.
Okay.
And so if you can combine multiple analyses,
Right.
you can kind of factor in what's true and what's not,
Okay.
along with motion palpation, which is feeling what's going on. And so that's what I typically do with a person is when they're face down or face up, whatever it may be, and I'm feeling the different segments in the spine or in the joints, I test that first with my hands. Then I go in and I check the feet. That's another way to test things. And I actually just stress test, or I have you do certain positions,
Right.
and that double checks whether or not that's a segment that needs to move or in the direction it needs to move.
Got you.
And those things give me an analysis of what's going on, but also you just knowing how the body moves.
Right.
If one side of your pelvis is stuck forward, that means the other side has to be stuck backwards.
Right.
There's no other way around
Right.
that.
Right.
And so if you can understand the way the body functions and the way it is, whether it's in neutral or movement or whatever it is, I think that's a big thing that helps as well.
Right. Right. That's crazy. Yeah, I can kind of relate that to a lot because being a paramedic,
Yeah.
there's certain things that this has to be true if this is
Exactly.
true.
Yeah.
Right. Yeah.
And
So yeah, and just me knowing that, you're kind of like my secret weapon, right? Because now that I'm feeling so good now, like I'm back to like I always say, this is my year of my comeback because
Yeah.
I'm feeling so good, right? So I just go like, pardon the phrase, balls to the wall when I'm at the gym,
Yeah.
and I just go and
Because
go
you can.
because
And without fear.
and I know whatever goes wrong, like I'm gonna come here and you're gonna fix me. Like my
Exactly.
check engine like
Yeah.
goes on. I know, okay, I kind of limp back in, but I don't care whatever it is I've been, whether it was my shoulder, you'll grab me and do whatever, and I feel it go back into place, my rib, and it gives me such confidence,
Yeah.
and it just makes me feel so much better. And I'm like, how did she do it? Because like I said, I've never encountered somebody that
Well,
does that.
I have to also give a lot of credit to my mentor.
Okay, yeah, of
And
course, yeah.
she showed me so many things that
Yeah.
were never taught in school.
Okay, yeah.
Things that I've never seen other chiropractors do.
Okay,
And she studied all over the place, and she's worked with a lot of people. She's retired now.
okay,
But she was amazing.
okay.
And she showed me so many things, and I still like from other chiropractors, like my chiropractor that I've interned with, or other chiropractors that I've worked with. They've shown me so many different techniques that
Right.
you wouldn't get without experience or
Right.
without trial and error. And I just try to be as much of a sponge as I can,
Yes,
and
yeah.
absorb everything they tell me and use the parts that benefit my patients and are helpful to me. And so
Right.
that's how I develop my own techniques.
Yeah.
Because I wouldn't say I just use one technique. I
Right.
use a little bit of probably every technique and somewhere in
Exactly.
between.
Yeah, exactly. Because it's not cookie cutter.
Exactly. Nobody's
Um,
the same.
I'm like that a lot with my personal training. I'm always trying to learn more.
Yeah.
And I don't have just like one approach. I'm find things that I think might work, try them out, and I'm like my own guinea pig.
Yeah.
I'm able to try these things out. Hey, it's kind of working, and I'll go to a client. Hey, let's try this today and see how you like it. Maybe
Yeah.
it works, maybe it doesn't. Maybe you like it, maybe you don't. What doesn't work for me, well, let's try it anyway because it might work for you. And
Exactly.
to me, that's how anybody should approach anything. Don't be so tunnel vision. Even like treating a patient. When I'm working for the fire department, don't get stuck on it has to be this problem.
Yeah.
It could be something else. It could be several things.
Exactly.
And there's not always just one approach fits all. You have to be willing to be
You gotta be
open minded.
malleable.
Yeah, yeah. You have all these tools in your toolbox, and you pull them out, and you have to be able to use them as needed. And like you're telling me all these things, I'm sure you're going through a process in your mind. But to me, as I'm laying there, it's like it's happening instantaneously.
Yeah.
Like I know you're going through all these different things, but for me, it's like you're not even thinking. It's just like doom, 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 doom.
After a certain point, it does start to become
Right.
second nature. But then you do run into really complex cases
Yeah.
sometimes.
And that's what I was going to ask you. Do you ever like sit there and like
Yes.
WTF?
Yes, more often than you think. Because I don't like people leaving if there is one little thing lingering. I mean, they have to obviously go home. I can't keep them overnight.
Right.
But I'll sit there and I'll think and I'll think and I'll do my research and I'll email people and I'll say, have you seen this before? What do you do with this?
Right.
What do you do with that? Because there's nothing wrong with saying, I don't know.
That's
There's
the most powerful thing to say.
Because
sometimes that's the smartest thing to say.
Exactly.
Yes.
And so there's so many people who've been around before you, done things before you. And
Yes.
you got to reach out and figure out what's going on if you can't answer the question yourself. And if you can't help someone, you have to send them somewhere that they can be helped. But I do always try my best to figure out what's going on. And I'll sometimes stare at a set of x-rays or a set of orthopedic results or things like that. And I'll just stare and see what possibly else could be going on.
Yeah.
And I'll do more research. I'll look at case studies, whatever it may be. And eventually, most of the time, which thank God, I do come to an answer and we do figure it out. But there are times that there are complex cases because nobody's textbook isn't real life.
Right. Exactly. Thank you. Yes. I have a running joke with a guy at the fire station. One time I told him, because I'll ask him a question, he'll just I know he's making up an answer.
Yeah.
I said, sometimes the smartest thing you can say is to say, I don't know.
Yeah.
And now every time I ask him something, I don't know. I said, no, you can only use that so many times.
Yeah.
Because now I don't think you're smart anymore. They get to the point where you pass that threshold. You're not smart. You're on the opposite spectrum now.
Yeah.
And so speaking of your mentor, is there anybody else, any special shout outs you want to give, acknowledgments to other people that might have? Yeah.
Dr. Jamie Marshall in Magnolia. She's where I did my internship.
Okay.
She was amazing. She was a great teacher, and she does a lot of integrative medicine as well.
Okay.
And so, definitely a shout out to Dr. Marshall. She's awesome.
Awesome. Anybody else? Anything?
My chiropractor as a child, Dr. Wolf.
Okay, awesome.
And so he's awesome as well. He's still in practice too.
Oh, that's great. Yeah. So, I mean, I know you've got your place here. Is there do you have any long-term goals? Is there something you're hoping in the future to do or?
Well, so the clinic is named Blue Zone Advanced Chiropractic for a reason.
Right.
So chiropractic is amazing and it can help with so many things and it's holistic, but so are Blue Zones. Blue Zones, they have the lowest rates of disease, highest expectancy, lowest mortality for those diseases as well, and they live overall a better quality life. Okay.
What is a blue zone?
So blue zones are regions in the world where people have high expectancy, life expectancy, high quality of life, low levels of depression, and low levels of obesity and disease.
Okay.
Okay. And what makes them so special, or what leads to them being blue zones, is a bunch of things. So, one, it's obviously a healthy diet. It's movement, regular movement. Doesn't necessarily mean having to be killing yourself all the time, but motion. Right. Motion is lotion, right?
Right. I like to say movement is medicine.
Yes, movement is medicine. That's a better way even. And then they have social connections. I mean, when you're around other people, you empower each other. You feel better with each other. Yeah. Spiritual connection, whatever it may be.
Right.
As well as being in an environment that's high in minerals and nutrients and things like that, as well as friendship and family and all of those different things. And all of those things together are what make people happier, live longer, live better.
Right. And
chiropractic helps with some of those in the way that we can help keeping you mobile. We like to be a community for our patients. We are happy when our patients are happy, sad when our patients are sad. Right. We're there for each other. We also like to encourage a healthy lifestyle. We give guidance, whether it be nutritional or supplemental, and that's what the functional medicine aspect is, so we can get away from all that disease.
Right.
Things like that.
Yeah, because I noticed you got the posters of like these different places
Yeah.
in the world, and I was like,
Yeah, there's Sardinia,
yeah,
there's Greece, there's Japan, there's Loma Linda in California, and then um, there's Costa Rica.
okay.
That's what it was.
So going back to my previous podcast I had, we one of my episodes was a DNA reveal. I
Okay.
did my DNA, and I actually had a high percent. I want to say it was my fourth highest percentage was from Sardinia,
Very cool.
and
So
it's
you're Italian.
beautiful.
Yeah, it is gorgeous.
Yeah, so I always tell my wife, "Hey, we need to go visit
You
my
do.
people one
That
day. Yeah,
that
go
is
see my uncle or something."
yeah. That's one of the blue zones I've actually been to.
Okay, and
Yeah.
it was beautiful, I guess.
It was amazing. I
Okay.
mean, that's really what inspired the concept here.
Okay.
Sardinia specifically, and that's when I learned about the blue zones.
Well, you're
and-
welcome.
yeah. Thank you. I mean, thank you to your people.
Yeah.
But yeah,
That's awesome, man. So, yeah, like I said, I tell everyone they probably get tired of hearing about you, to be honest with you, because I'm just,
well,
you know,
thank you.
always giving praise, and like I said, I truly feel, and I mean this from the bottom of my heart, that you gave me back all that stuff that I feared I lost. So I'm always hyping you up. I'm always telling people, I'm always trying to send everybody that I
Yeah.
know to come see you. So those people that are hearing this haven't heard me sing your praises. How do they get in contact with you? Where are you located?
So we're located between Tomball, Magnolia, and the Woodlands, kind of not in the middle of any of those, okay? On 2978 and Woodlands Parkway, and we're in the Sterling Ridge area. And you can give us a call at 281-688-5580. And you'll be able to reach the office, or you can go on our website. And actually, if you wanted to, you could book right directly on there. We have our link right there to be able to book your first appointment.
Right. Okay. So I used to see you at the other location. Then you moved.
Yes.
Then I went into depression again until I found you. And then I came to your new location, and you asked me. I don't know if you remember this. You asked me the first time you said, how was it getting here? Was it further? And I said, distance-wise, it was a little bit further because there was not a lot of red lights. It said I
Yeah.
got here faster. But do you remember what I told you? I told you, I don't care if you had moved to Dallas.
Yeah.
I would have made that trip. So anybody listening, I mean, how far is it worth it? Whether you're on the other side, how much is it worth it to you to feel better, to get your life back? To me, I would drive, and I meant it when I said, if I got to go every weekend to go see you in Dallas, I would have done it because I knew that's the type of impact you had on me. So I'm recommending anybody out there.
Thank you,
I don't
Tom.
care where you're at. You need to make that trip. You might even be down the street. Come see her. It's worth it. Like I said, your health is your wealth, right?
Very true.
You get that taken care of.
You
come
don't get
see
your
doctor.
body back. I mean, it's only
No.
one body, one
You only get
spine.
one, yeah. And as far as I know, we only get one go round.
Yeah.
So make the most of it. You'll be so grateful for it. If you're in any type of pain, I had a buddy that I hadn't seen in years yesterday at the fire station.
Yeah.
He was moving like I used to. I could just see it. He couldn't straighten out his back. And of course, I'm immediately giving him your number. But I remember, because it made me remember that's how I was.
Yeah.
And I felt so bad for him. And I just knew all he's got to do is call you, and he won't feel like that anymore. So anybody out there, that's feeling like that, whatever issue it is, I don't care what the issue is, whatever the problem is, come see her. I'm sure she can take care of it. She's taken care of every issue that I've had. And like I said, that's why I was adamant. I wanted you as my number one guest. Like I said, you were my number one draft pick. I'm so glad, you took the time to visit with us, explain a little bit about things I didn't know.
Yeah, I love to let people know what
Yeah.
we can do to help.
Yeah, and follow her on Instagram. You'll see all her posts. You make those awesome little videos. You were
Yeah.
telling me how you do it. I was amazed just by that. So come visit her. I look forward to having you again at some point on the show.
Thank you.
We can follow my progress
Yeah.
and how I'm doing. Make sure I'm still
Definitely.
doing well. And once again, thank you so much for joining me on the
Thank
show.
you.
And I look forward to next time.
Thank you for having me, Tom.
All
It was
right.
awesome.
Thank you.
Thank you.
Alrighty.